It's a pleasure to be here, and I'm delighted to talk about the work we've been doing for the last 5 years. If I were to ask each of you in this audience, have you or your partner been exposed personally to dementia or stroke, roughly 3/4 of you would raise your hands. If I were then to ask dementia, stroke, or depression, virtually all of you would raise your hands. We have a slow-moving pandemic of age-related brain disease that dwarfs the impact of the pandemic that we just survived, COVID-19. But I'm very excited to talk to you about the work that we've been doing that we think will lead to action against this pandemic. So the key recognition is that dementia, stroke, and depression are preventable. This is the result of decades of work of epidemiologists and other scientists who have carefully documented the role of modifiable risk factors in the risks of these conditions. Roughly 75% or more of strokes can be attributed to modifiable risk factors, 45% of dementias, including Alzheimer's, and at least 35% of depression. What we need now is a way to engage individuals everywhere in modifying those risk factors. At the McCann Center, we worked for 5 years to answer the question raised by our patients and in particular their family members. What can I do to take good care of my brain so I don't end up like my mother or my father, my sister or my brother? And what we found was that even though we doctors thought we knew how to answer that question, we weren't getting through to our patients and families. So we worked with them to come up with a way to present reliable information on risk factor modification in a simple way. And what resulted was this brain care score. 21 points, you see the 12 risk factors there. And we have now validated this score in over 500,000 individuals. I'm showing you data from the largest study in the UK Biobank. And what you can see is there's a substantial benefit to raising your score just 5 points for reducing your risk of dementia, stroke, depression, and, no surprise, heart disease, lung cancer, breast cancer, and colorectal cancer. And I highlight to you within 12 and a half years because what we found is even when you ascertain the brain care score in individuals under the age of 50, their risks of these chronic diseases are substantially reduced so that you see a real difference in the incidence by age 62 or 61, all before private payers can hand off our citizens to Medicare. The brain care score engages the lay public in particular. When we partnered with the New York Times to create a version on the app, and you can all go and find it, those of you who have the New York Times app, within the first week, more than 1 million people had filled out their brain care score. We have a website that is open to anybody in the world, and so far, 220,000 people have filled out their brain care scores and counting. So what's special about the score? Well, one of the things that we learned in our working with patients and families was that the term brain health is confusing and stigmatizing. How do you answer the question from an individual whose husband has had a stroke? She tells me, "Doctor, you told me that when my husband had a stroke, a part of his brain had died and wouldn't come back. Does that mean his brain will never be as healthy as mine?" Or the parent who asks about their son with schizophrenia. "I understand schizophrenia is a chronic brain condition. Does that mean my son's brain will never be healthy?" So what we learned was health is a term that is so often heard as you either have it or you don't. And all of the nuance that we in the physician community use to discuss brain health is lost in the conversation with individuals. So what we learned in order to help people understand what we wanted them to understand, which was the answer to that question, what can I do to take good care of my brain, we adopted the term care. Anybody, no matter what your state of health is, can take good care of their brain. And this has led us to a vision of personalized prevention. So, how do we see the brain care score spreading? Well, one of the things that you have to understand is that the enthusiasm around the brain care score has gone global among physician leaders. Within a few months of the publication of our first validation study, we had formed the Global Brain Care Coalition, bringing together physician leaders from around the country and the world to focus our efforts on studying the brain care score, spreading the brain care score, and ultimately improving it as new knowledge was accumulated. Crucial to this is the embrace of the brain care score as an approach to tackling this pandemic, this global pandemic. And we see opportunities to bring the brain care score into media, for example, what the New York Times did. Continuous glucose monitors, for example, can become continuous brain care monitors, expanding the reach, expanding the role of these continuous physiologic monitors beyond their initial release for diabetes. And certainly we've had lots of interest from large companies who have connected health apps. So our vision at the level of the coalition, the Global Brain Care Coalition, is let's go and reduce the number of new cases of dementia, stroke, and depression by 10% over 10 years, 30% by mid-century. Crucial to being successful is a way to communicate and communicate with populations everywhere and engage populations everywhere at the level of engagement that each different group of us needs or chooses. So we have developed the Digital Brain Care Companion, which will supply that infrastructure for scaling, because fundamental to tackling a pandemic is you have to be able to track your improvements or lack of improvement so we can know what interventions are working and what aren't. So our progress to date is validation studies. We've developed a behavioral science platform in partnership with the University of Pennsylvania and the Wharton School. We have mobilized grassroots around the country and the world, and we've begun the investment in the Brain Care Companion. So we seek partners to take the next steps to develop and launch the Brain Care Companion, expand our grassroots community partnerships, and establish commercial partnerships. The market here is substantial. We've been approached by representatives from the health insurance industry, the hospital, the network industry. Large employers in particular are very interested in bringing benefits to their employees that will engage them and improve their health, and certainly the fitness industry. Thank you very much for your attention.